If your cholesterol is high, whether it runs in the family or not, one of the first questions my patients usually ask is, what can I eat to help out? And in this video, I'm going to walk you through the 3 food groups that I recommend prioritizing when you're trying to lower your cholesterol numbers with a food-first approach. Not the trends, definitely not the extreme diets, just simple choices that you can incorporate reliably to move your numbers in the right direction. I'm Dr. Kenny, and as a functional medicine practitioner, I leverage food signals as safety signals to your chemistry that help to make measurable differences over time. And for more food first healing videos like this, tap the like button to send me a signal that you'd like more. Before we dive into the first food group that I recommend, let's clarify what we're trying to move. If your cholesterol comes back high, your first emotion may be confusion. You may not feel different, you may not look any different, and yet there's the number staring right back at you. LDL cholesterol is one that's first prioritized and most commonly screened for, and it matters mostly because of what it contributes to over time. Simply put, when LDL particles are circulating in higher amounts than normal, they are more likely to become retained into the arterial wall and initiate the process of plaque formation. This process is sneaky, it's gradual, it's cumulative, and it often unfolds over years to even decades before your lab markers even shift. LDL has been labeled bad cholesterol, but that oversimplifies the situation. LDL doesn't work in isolation. Both inflammation and the environment of the arterial wall influence how that process actually occurs. In addition to LDL cholesterol, we also have more advanced markers like ApoB. If you'd like to know more about that, let me know in the comments below. But LDL does remain one of the most commonly screened and the most actionable measures that we can influence with a food-first approach. And lowering your LDL concentrations, if they're elevated, is still one of the most reliable ways to reduce your cardiovascular risk, which is why that is the focus here. If your LDL is trending upward year after year, even modest reductions can have lasting impacts to your cardiovascular risk. And when I assess cholesterol patterns with patients, we think in years or decades. That perspective shift changes how you make food-related decisions. And this is where the secondary question is usually about genetics. One of the most common dismissals I hear, both from other practitioners and patients alike, is that it just runs in my family. And genetics absolutely matter. Your genes influence how your body transports and processes cholesterol. Genes shape baseline tendencies and represent potential, but it's still a spectrum. And so genetics are not often the full story. Your daily inputs and your environment matters tremendously. For instance, what you eat and how active you are dramatically influence and signal to your genetics whether or not they express themselves on a spectrum of function to dysfunction. So the big takeaway is, even with a strong family history of high cholesterol, your cumulative lifestyle factors can affect your trajectory. It doesn't erase the importance of that genetic information, but it does mean that you have strong, actionable leverage points. And at the same time, it's important to acknowledge that these leverage points don't act the same and look identical for every person. 2 people can make the exact same dietary changes and yet have completely different outcomes. Your activity levels, your sleep quality, your stress chemistry, body composition, and genetics all influence how cholesterol responds. So while this video is about foods that help, if you've ever followed somebody else's advice and thought, why didn't this work for me as well as it did for my friend or my family member? That variability is part of human physiology. Just know that there are always deeper questions that we can ask through a functional lens, if this is your experience. With that in mind, let's anchor a bit into the language around the research. When dietary recommendations are formalized in a research setting, they are created from highly structured clinical summaries and randomized controlled trials. One of the most important limitations of food-related research to acknowledge here is that it reflects averages across a population that is being studied in these incredibly controlled settings. Those averages and findings don't always translate back to the individuals, especially when we apply the intervention to a single person, because food isn't just a single compound. Food contains hundreds of biochemical components that interact with our thousands, even millions of chemical reactions. And those reactions vary person to person, from the genetics to the environment and beyond. So that's the nuance I always try to hold in food-first conversations like this. Incredibly powerful levers to pull, but context and individuality matter incredibly. Despite that, we can still gain some actionable information from these summaries across populations. And a few themes show up repeatedly. Specific dietary shifts or inclusions produce measurable results in populations that favorably affect LDL cholesterol. And while the effects may not be dramatic or overnight like taking a medication, they still represent measurable, predictable movement in the right direction. And that matters because when we're talking about prevention or health optimization, that measurable change that stacks up is what matters over time. And by the way, if you're one who likes to dive into the research and see it for yourself, I've included a free research summary that links to some of the articles I used for this video. It's in the pinned comment in the description below. So let's move into the first food category that I like to prioritize with LDL cholesterol. The first category are plant-based sterols and stanols. These are naturally occurring compounds that are found in many different plant foods. Their role is fairly straightforward when it comes to the way the body processes cholesterol. Simply put, they reduce the body's ability to absorb cholesterol in the digestive tract, which means ultimately less of it makes it into your bloodstream and circulation. Over time, that reduced absorption results in lower LDL cholesterol levels. Both clinical trials and meta-analyses consistently show that adding plant sterols to the diet produce measurable reductions in LDL cholesterol in those with elevated levels. And in practical terms, these compounds show up in fruits, nuts, seeds, vegetables, and a wide variety of plant-based foods. In these food forms, they're often found in smaller amounts, which can still be leveraged if you eat enough servings of your fruits, your vegetables, nuts, and seeds throughout the day. But they can also be concentrated in supplements if you want a more clinical dose of the active ingredient of plant sterols and stanols. But the plant-based foundation has multiple benefits beyond just LDL cholesterol as well. It's not flashy, and this goes back to what Grandma said, is eat your vegetables, and that time-tested reality is what makes this so useful. Now let's move on to the second food category, which works through a different pathway. The second food category is soluble fiber. Soluble fiber, when combined with water, forms a gel-like substance in the digestive tract. That gel binds to cholesterol and helps to escort it out of the digestive tract. So rather than reducing absorption directly, as with plant sterols and stanols, this mechanism helps to increase the elimination of cholesterol. Foods that are naturally high in soluble fiber include oats, beans, some fruits, barley, and other whole grains. Even large randomized controlled trials show that increasing your soluble fiber predictably lowers LDL cholesterol, and it does so in a predictable, incremental, and a dose-dependent way. And this speaks to a larger functional pattern, which is important, which is steady, regular elimination. Now, there's one more food category that often surprises some people, and that is soy products. Soy contains plant-based proteins and compounds that have been shown to reliably, modestly lower cholesterol levels. When incorporated regularly, soy-based products can influence cholesterol levels positively, and the overall pattern, given that soy is highly subsidized as well, quality of soy matters, so opt for organic if you're able to. Multiple meta-analyses of randomized control trials show that replacing other sources of protein with soy protein produces modest but consistently lower LDL levels. This doesn't mean you need to replace every other protein source with soy, but it does mean when it's part of balanced intake of protein that it can support cholesterol lowering in a meaningful way. Foods like tofu, tempeh, edamame, and unsweetened soy products can go a long way here. And the impact comes from regular inclusion with all three food groups we just spoke about. These food-first shifts sit alongside other important strategies to help reduce LDL cholesterol as well. These include reducing your saturated fat and trans fat intake, and when applicable, Even a 5% reduction in body weight can dramatically lower LDL cholesterol levels. There is a common concern that's often voiced around soy products whenever they're mentioned. And one of the most frequent questions that comes up is whether or not soy-related products and their related phytoestrogens relate to an increased incidence of hormone-dependent cancers. Summaries of the current research do not show that do not support the idea that moderate intake of soy products are related to an increased risk of breast cancer, for instance. In observational data, which is different than randomized controlled trials, regular soy consumption is actually associated with a neutral or even a protective benefit against cancers. That doesn't mean more is more. It means that in typical dietary amounts, soy consumption does not appear to carry the risks that many once assumed. And now it's worth noticing how these patterns in these foods intersect with one another. When I think about cholesterol in a clinical setting, I'm rarely isolating one number and focusing on it alone. I'm looking at patterns across lifestyle, across body systems, and across functional patterns that stack up over time. These three food categories are relatively simple. LDL responds to our inputs, and food is one of those inputs. Cholesterol levels are regulated primarily in the liver. If liver function is overly challenged or impaired in some way, those numbers may not move the way that you expect them to when you're doing all the right things. In supporting the liver's regulatory systems, become just as, if not more important than the food signals. And in this next video, I'll walk through the top foods that help to support liver health and function. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.